Hey everybody, welcome back to Drug Talk. My name is Garrett Campbell. In today's video, we're going to be doing a more simplified version of a video that we covered in the past on Atorvastatin. And we're starting right now. Just keep in mind that this channel is for information purposes only. So the first thing we'll discuss in this presentation is what this medication is used for. So Atorvastatin lowers high cholesterol and triglyceride levels. It reduces angina, stroke, heart attack, and certain heart and blood vessel problems. This medication is known as a statin. Now, how to use this medication. So first off, take your medication as directed. Your dose may need to change several times to find what works best for you. Take this medication at the same time each day, and swallow the medication whole. Do not break, crush, or chew it. Read or follow the patient instructions that come with the medication, and talk to your doctor or pharmacist if you have any questions. Now, what happens if you miss a dose? So take a dose as soon as you remember. If it is less than 12 hours before your next dose, just skip the next dose and take a regular dose at the regular time. Do not take extra medication to make up for a missed dose. We'll now discuss some warnings associated with Atorvastatin. So it is not safe to take this medication during pregnancy. It could cause harm to the unborn baby. So tell your doctor right away if you become pregnant. Tell your doctor if you have kidney disease, diabetes, an infection, low blood pressure, muscle pain or weakness, seizures, thyroid problems, a recent stroke or transient ischemic attack, or a history of liver disease. Tell your doctor if you consume alcohol regularly. This medication may cause liver problems or myopathy or severe muscle damage, which could lead to kidney problems. Your doctor will do lab tests at regular visits to check on the effects of the medication, so be sure to keep all your appointments. We'll now go over some side effects or adverse reactions. Over the first two slides, if you experience any of these, you just want to get in touch with a physician right away. So if you had an allergic reaction, which could present as itching or hives, swelling in your face or hands, swelling or tingling in your mouth or throat, chest tightness or trouble breathing, reach out to a physician if you have blistering, peeling, or a red skin rash, a change in how much or how often you urinate, if you have dark urine or pale stools, nausea, vomiting, loss of appetite, stomach pain, yellow skin or eyes, if you have a fever or unexplained muscle pain, tenderness or weakness, or unusual tiredness. For these side effects here, you would just want to mention them to your physician at your next appointment, or even talk to your pharmacist about them the next time you pick up a prescription. So if you had arm, leg, or joint pain, if you had diarrhea, or if you had a stuffy or runny nose. Alright everybody, that's all we're going to talk about today with Atorvastatin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.